Disclaimer. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on The Heavy Truth.
Hello.
Hi,
Welcome back.
welcome in. How are you?
I'm good. How are you?
Good, I'm Ben.
I'm Amy.
And we're the Heavy
We're the Heavy Truth.
What's up? What's new? What's exciting?
It's finally warm here, which is good.
Yes.
It's cold in the studio.
Oh,
Yeah,
well,
it is
yes, it is
cold in
cold.
here.
Yes, for sure. But outside it's nice. So, you know, it's fun.
Fun.
Yeah, it's so much better than it's, you know.
At least there's no snow.
Oh, yeah. Yeah, we haven't had snow for a while, but it's been chilly.
Our 6 months of winter is over.
Is it though?
It's
May. Is it?
Well, it's June now.
Not really. Oh, it's June now for our podcast? Oh, sorry, guys. It's June now. Obviously, they know that we record. I was going to say videotape. Record these a little bit ahead of time. So it's Happy June, Amy.
Happy June.
Ooh, it's summer.
Yeah, we have some updates to give for this episode today.
What is today's topic we're doing?
So we are going to talk about, well, what we always talk about, right? So the Heavy Truth Podcast, what are we? We're here to honestly talk about obesity, medicine, weight loss, healthcare, and all the stuff that people are confused about. Try to clarify that.
Because there's a lot of stuff out there that people can get confused about.
Yeah, absolutely.
You know,
But
like me thinking it was May when it's actually June. Thank you for clarifying that. But today's topic, we are going to talk about Medicare and their upcoming GLP-1 Bridge Program. I'm super excited about this, right? Because, you know, Medicare for a long time didn't cover any weight loss medications. And then recently, within the last year-ish,
right.
Changed that a bit, right? To include weight loss medications for very, very, very specific indications.
Which are what?
Back then, you know, or still currently now, right?
Yeah.
Zepbound, right? Which was one of the GLP-1s. And it is covered for moderate to severe sleep apnea in patients having had a sleep study, usually within the last year or so, showing an AHR or REI of 15 or greater. That's the amount of apneic episodes during the study in each, on average, each hour. And many of the Medicare programs, right? Because, you know, everyone has different ones, United Healthcare, Medicare, blah, 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 Network Health, all of these different things. Some also want to make sure that you are CPAP and CPAP compliant.
Yep.
But they would cover it. Now, not at 100%, right? Cover it based on how much of your copay was paid already at the time, right?
Yeah, and they still have that $2,000 cap.
Yeah.
You know, so yeah, I mean, some people could be paying $600-700 until they meet that like deductible.
Right.
But that was for Zepbound,
That
right?
was for Zepbound.
You know, we have Wegovy, which that one was even stricter.
That was very strict.
And still is. You know, you have to prove
previous
heart attack, stroke,
or
severe like peripheral vascular disease.
right, as evidence, because you have people say, "Oh, I had peripheral vascular disease,"
Yeah.
but it's evidenced by a specific test called an ABI at a very certain rate. Otherwise, they were like, "No." And even if you were someone that had an MI, you had to be followed by cardiology, neurology. I mean, it was very, very. It still is very, very specific.
Yeah.
Things.
I did get one covered recently. Actually, this past week, wrote this long dissertation as to why this person should be qualified for it, and didn't meet the specific, heart attack, stroke, or the peripheral vascular disease, but had everything else.
Yeah.
So I just wrote, this huge letter, and they granted it, so.
And you're wondering now, are they granting it because they know this bridge program
That's
is
what
coming?
I was thinking.
Which is fine, great. More power to you. Or was it because of your expertise, Amy?
I mean, I would love to think that it was that, but no, I think you're probably right. They're just like, yeah.
Oh, yeah, I wasn't thinking it was your expertise, but yeah. Mm-hmm.
But yeah, so this individual was happy. But now people starting July 1st.
July 1st,
supposedly,
yes. Mm-hmm.
They're going to have more coverage,
More
but more
coverage.
for obesity specifically.
Obesity specific. However, again, there are still some limitations as to indications, right? So that's what we're here to discuss. And so right now they're calling it a temporary program designed to improve access to evidence-based obesity care while they gather data. So it's a temporary program right now. They're looking at it from July 1st through December 31st of 2027. So about a year and a half, right? To see what that future looks like, to see if they're going to continue to roll this out, right? And so they're looking at things like they begin, of course, everyone's going to ask, who is eligible? So right away, I'm going to say the most important thing before you run to your provider and say, I have Medicare, you must be enrolled in a Medicare Part D program. D as in dog, right? Meaning there's a standalone Medicare Part D prescription drug plan, or what they call PDP, or you have to be enrolled in a Medicare Advantage plan that includes a Part D. So Medicare Advantage, PD, so MAPD, right? And then what's important to know, Amy?
Well, it's still going to be based off of certain criteria.
Yeah.
So you can't just go in there and say, I want it. You have to meet BMI criteria.
Yeah, right.
But which is way different than what we were dealing with now. I mean, they didn't care that you were overweight or struggle with obesity. They don't care.
Oh, right.
You know?
So this even this program, which has limitations, is a huge step forward for those of us that work in obesity medicine and for our patients who, for years, we would have to say, oh, they have Medicare. Oh, the option would be out of pocket, right? And so this is going to help many people with the chronic disease of obesity seek treatment, right? Because too often I had patients who were on Medicare that were like, well, they don't care because they just think I'm old and I'm going to die, right? And so if we're looking at some of those clinical qualifications on this CMS GLP-1 Bridge Program, so it has to be prescribed for reduction of excess body weight and maintenance of weight reduction. But again, as we've always said, right, it has to be in combination with lifestyle modification, meaning nutrition and physical activity. So diet and exercise, like we've always said. And that is what's always been something that many insurance companies, not just Medicare, always wants to see in our notes that they're doing something with it. Calorie restricted diet, blah, 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 what their activity levels look like. Sometimes what they've done in the past that has failed, sometimes they want to see failure because why should we give them this if you haven't tried something else, right? But so when we're talking about BMI, right, the biggest one right now is they're kind of like I don't want to say the word easiest way to get the medication, right? But their most qualifying factor, if that makes sense, is a BMI of 35 or greater, right? You have to be 18 years old, BMI of 35 or greater at the time the GLP-1 therapy was initiated. Now, what my question was to people in our prioritizations department and stuff like that was, do they mean BMI at the time of me ordering this GLP-1 today, let's say, or maybe your BMI was now 30, but previously you were paying out of pocket for one of the other GLP-1s and your BMI was 36. So is it now going to qualify you based on your previous BMI when you started? Because it says at the time GLP-1 therapy was initiated. Well, that's when I initiated it. So that's something
so
that we have
say?
They actually didn't know. They didn't have an answer.
Yeah, because I've asked that too.
They said it's going to look like this. You're going to prescribe the medication for your BMI if it's less than 35 and say, I'm going to say, okay, so, Wegovy, Zepbound, blah, blah. I'm going to say, so I'm prescribing for someone BMI of 32, going to prescribe Zepbound in my notes saying that had been on Wegovy starting the year, blah, blah, blah. This was their BMI then. This is what their BMI is now, yada, yada, yada. This is why I'm switching. And submit and see if that is, if they're looking at the BMI from Wegovy or from Zepbound, which is now the initial, if they're starting this program kind of thing, right?
That's what I planned on. That's what I was going to do also. And then we also do that with other meds currently.
Yeah.
Like we always, when we get a prior authorization, we start at the original weight.
Oh, absolutely.
So hopefully it'll be the same.
So that's BMI of 35 or greater, right? And then I know you're looking into this. So what about if the BMI is below 35? And you're initiating, and let's say it's the first time they're on the medication or whatever. Are there factors that they need to qualify with?
Yeah, I mean, there is. And so part of it is a couple of them. So heart failure. Also, so go ahead.
Go on.
Okay, so heart failure, uncontrolled hypertension, and chronic kidney disease stage 3 or greater. Now, a couple of things. How do you're going to write, heart failure based off of so much of a, ejection fraction, whatever that's going to be. How do you know it's uncontrolled hypertension?
Right.
So again, there's still a lot of questions. So we will be learning a lot the first couple of weeks into July.
And what we're telling you is coming directly from the Center of Medicaid, right? The
CMS.
CMS, directly from them, from their website, from the information we've received from them. Like again, uncontrolled hypertension, right? Like, what are the criteria for that, right?
Is it just if they're on meds?
If they're on meds, or is it on a med but blood pressure isn't going down? We don't know what their definition is of uncontrolled hypertension, or what their heart failure with preserved ejection fraction, what their definition of that is, right?
Right.
Yeah.
And then for the 27 or greater BMI, you have to, from my understanding, and not from this form I'm looking here, something that I'd seen from one of my reps is it has to be in addition to like the previous one. So like 27 and greater, you have to eat pre-diabetes, previous heart attack, or a previous stroke, or symptomatic peripheral artery disease. Does that mean those? And then it has to also be something from the 30 group?
Right. That's again not clear either.
Gray.
And I asked that question to the Zepbound rep. And I said, oh, well, I mean, I kind of feel like if anybody came at 27 and I was like, oh, they're pre-diabetic, that's all I got to say because I can show numbers for pre-diabetes. And does that qualify? Or do they then have to say, and because they're below 30, below 35, and they didn't have an answer either. So,
no,
but
I think it'll.
On the plus side, we now have indications for these medications, and specifically for obesity and weight loss, which we hadn't had before.
And we know Medicare Medicaid, like we follow a lot of what they do.
Yes,
So
many
if
of the
they're-
private insurance companies will start to open their things up based on what the Center of Medicare and Medicaid does, right?
Yeah, what
If they're
they-
starting to do this, then they'll do this too. They kind of fall in line.
Yeah. So we're hopeful that that's going to change, open more doors for more.
But I want to be clear, it's not just any GLP-1, right? Right now they are, or I shouldn't say right now, because it's June, right, Mike? Right, producer Mike? It's June. So July 1st, the medications that are going to be eligible for the GLP-1 Bridge Program for obesity include Wegovy, the injections and the tablets, right? So the oral medications, the daily oral medications, and the once weekly, injections. Foundeo, which we talked about during one of our previous podcasts, the Lilly oral medication, right? And while Zepbound is going to be covered, the once weekly auto injectable is not covered. Neither are the vials, but the Zepbound Quick Pen is the medication that will be covered. So that's what needs to be ordered and sent to the pharmacy or whatever, or for prior authorization. It has to be the Zepbound Quick Pen, and for those people.
Which is just a multi-dose pen.
Yeah, multi-dose pen, kind of like, now I'm not saying it does, I'm just giving some examples for our listeners that are out there, like the Ozempic pen, right? Or Saxenda. The doses are in that one, all the doses are in that one pen or whatever, right? And so
Victoza.
Victoza.
Yeah.
So it's kind of like that, right? Your 1 month of medication, whether it be the 2.5, the 5, the 10, whatever it is for Zepbound, all 4 doses are in one pen, meaning you use that one pen once a week for 4 weeks, and then you're done with that pen. So it's called, and it's literally when you would prescribe it or have your PCP prescribe it or whoever is prescribing for you, it's literally Zepbound Quick Pen.
Yeah, it'll be interesting. It'll be interesting to see how it kind of plays out, but definitely in the right direction.
Yeah,
for sure.
yeah. Yeah, and we've already talked about the cost of medication, and I think patient savings and patient costs is going to be very good with this coverage. What it looks like now, right?
Yeah, $50 a month.
Yeah,
but it won't go towards their deductible.
Right. Exactly.
You know that.
Yeah.
Yeah.
Copay stays the same regardless of the Part D phase. Right. And like you said, it does not go towards their Part D out-of-pocket costs or their Part D deductible. Amy, how does it work though?
The medication itself, how does it work
No,
specifically?
the program. No, I know how the medication works.
Oh, the program.
Yeah.
Yeah. Well, the program, you have to have a provider write the prescription for you. You can't just order it online, right? But then you still have to go through prior auth, which means we have to still make sure that you are qualifying for it.
Right. We're meeting those criteria. We talked about the BMIs and the comorbidity indicators and things like that, right?
And then I think there is going to be specific pharmacies that are going to be enrolled in this bridge program. Is that right?
Yes. I don't know what the specifics are behind that, but
so it may not be every pharmacy.
Right.
Right.
It might be, for example, the Zepbound Quick Pen, it might have to go to Lilly Direct for all I know. Right. I think that's something again. And I do believe that there are some Medicare, just like some insurances, require specific pharmacies.
Yeah.
Right. So that's something to look at. And the pharmacy process will claim everything through the CMS, bridge, GLP-1 bridge program. Right. And that's what I can tell you. That's what I know. And I think that's starting June 1st. And I think it's going to make a big...
And it's all 50 states?
All 50 states, yes. All 50 states. So our
Medicare. Listeners out there in California and New York?
Yeah.
Same.
Yeah.
Not just here in the Midwest. So that's really good because, we have some people paying, $7,000, $8,000, $9,000 a month.
9,000?
I said $7,000, $8,000, $1,000 a month.
Oh, $7,000, $8,000 or $1,000 a month. I just said $9,000 a month, and I was like, "Girl, for that I can fly to Mexico." And, I'm sorry, that's a different podcast.
I mean, back in the day when they first were out here,
it was $1,200, $1,300, $1,400, $1,500, depending on where you were. getting it from, right? Yeah, absolutely.
But, again, the right medication for the right patient.
Yeah, that's the biggest thing, right?
Yes, you just have to make sure that it's you're treating the right thing, But I feel as though, we're definitely going to learn more as this goes on, but.
And everything, I feel like everything revolves around this BMI thing, right? All criteria about the BMI, blah, blah, blah. And as we've learned, the BMI is still a very imperfect measurement, right? I mean, two people can have the exact same BMI, but that doesn't mean that their body composition, and they have the same metabolic health.
Exactly. Because you can have someone with a lower BMI who's very metabolically unhealthy, right? And then you can have someone who, has a BMI above 30 and, at least not yet, labs work good, EKG looks good, they have real good genetics at that point. But so you have to look at the whole picture.
Yeah, because that BMI doesn't look at, muscle mass, skeletal mass, anything. They're just looking at they're looking at a number, a qualifying number. And you know what? I get it. That BMI has been accepted by so many healthcare areas, right? That we just continue to accept it, even though it's not a realistic impression of health or metabolic health, like you said.
Yes, I know. Yeah, it's all about cardiometabolic clinics now. That's like the new thing, and that's because it's all related to obesity.
Right.
But so this is definitely promising news. More to come, of course, but. When we've been hearing about this, it was something that was maybe going to unfold beginning of this year, then it got delayed a little bit, but now it's all over paperwork and it's on branded stuff. And
yes, it's on branded stuff.
Yeah,
they were advertising at conferences. And
so we know it's coming. It's just, we don't know all of the details, but
yes. And please bear with all of your primary care providers, obesity providers, whoever is going to be submitting these prior authorizations, because while Amy and I work for a large healthcare organization, there's still questions behind prior authorizations there too. As we just said, we don't know if that BMI of 27 means this and this and this, and we don't know what turnaround time looks like coming from Medicare when we submit prior authorizations, or what additional hoops they'll make us as providers give to them to say XYZ.
Yeah.
Right?
Or if they're going to have to be sent to a specialist like us.
Yeah, or a specialist, or a specific pharmacy.
Yeah.
Or we just showed you the limitations in, like, for example, Zepbound, right? It has to be their QuickPen, right? Now, I've been told in the past that the QuickPen was only through Lilly Direct. And now I've found a few other pharmacies that require, 3 other insurances that require it be the QuickPen sent. Actually one was Blue Cross Blue Shield, and they required the QuickPen. And they're Blue Cross Blue Shield of Illinois. They required the Zepbound QuickPen, and it had to go to this person's mail order pharmacy. In order to it, and it couldn't be
changes every day. Changes every day. What they say, but
this is promising, and this is great, and this will open up the treatment of obesity for thousands, if not millions, of people.
For sure.
In the U.S. To become more healthy and get things
just more access to
care, more access to care, which is the most important thing. Right.
Well, more to come, as soon as, when we get information, we'll forward it on. Please send any questions that you guys may have. But this is really promising for us, and we're excited.
And if any of you listening are on Medicare and you find out something that we haven't said about, by all means, let us know so we can help other people too.
Absolutely.
Right.
Good.
So on that note,
thanks for joining another episode of that Heavy Truth podcast. I'm Amy.
And I'm Ben. and listen to us on all platforms that you listen to your favorite podcasts and streaming services, and find us on Facebook and TikTok and Insta and
TheHeavyTruthPodcast.net.
and the heavytruthpodcast.com.
Not net.
Producer Mike was wrong. Wah, wah, wah. heavytruthpodcast.com. That's our newest addition to our repertoire. Yes. Yes. Our growing repertoire for all the tens of people.
Baby steps.
Baby
Baby
steps.
steps.
Baby steps. Awesome.
All right.
Well, until we talk to you again,
Yep.
I'm Ben,
I'm Amy.
and this is
The Heavy Truth.
Bye.